Sponsored by Novartis and is intended for U.S. audiences only.
Hello, and welcome to today's discussion on the cancer burden in the Black community. I am Tawana Thomas Johnson, and I serve as the Chief Diversity Officer for the American Cancer Society. Today's discussion is such a timely and very personal conversation for many because far too many of us have experienced cancer either as a patient, a loved one, caregiver, or friend. Cancer, in fact, is the second leading cause of death in the U.S., and Black people have the highest death rate and shortest survival rate of any racial or ethnic group in the U.S. In fact, Black women are 41% more likely to die from breast cancer than white women, despite a lower incidence of the disease. The reasons for the disparities are complex and multifactorial, some of which we will explore today. But to begin, I think we can all agree that when a cherished member of society is diagnosed with cancer, whether that's a teacher, a community leader, or a local business person, it is felt not only by their loved ones, but also by the people they helped, served, or supported. And just as a cancer diagnosis can have an impact on our community, we as individuals can also have an impact on our community. We can be the ones to support and encourage our friends, family, and loved ones to look after their health, to get screened, and to pursue quality treatment if needed. Today, we are joined by a number of people who have experienced a cancer diagnosis firsthand. Each person brings a unique perspective and experience regarding how to be the impact that their community needs to help address the disparities we see in cancer care for the Black community. To get us started, I'd love to have our panelists introduce themselves, starting with Dr. Kamal.
Well, it's good to be with everyone, and thank you, Tawana, for the introduction. I'm Arif Kamal. I'm a medical oncologist and palliative care physician at Duke University and the Chief Patient Officer at the American Cancer Society. That means I and my team lead the ACS's patient support vision and strategic plans to improve the lives of cancer patients, their families, their healthcare providers, and their communities. And we do this by a slew of important interventions across those ecosystems and across those stakeholders. And for me, this is very personal in addition to being professional. I am the bereaved son of a mother who died of breast cancer. And for me, this is a lifelong journey to make sure that people have a better experience than what we faced as a family, and to make sure that we as a society, all populations, including my Black colleagues, have a better experience to prevent, early detect, or survive cancer.
Thank you, Dr. Kamal. Rashima.
Yes, it's a pleasure to be with you all. My name is Rashima Kemps Polanco, and I am the Executive Vice President for Novartis, and I oversee the oncology unit here for the U.S. I am so thrilled to be in this privileged position to lead this organization, one, because it has a great mission and great purpose, but for me also personally, I lost my best friend to metastatic breast cancer in 2020. At just the age of 48 years old, and this work is near and dear to my heart and the communities that we serve. So it is wonderful to sit at this table with all of you.
Thank you, Rashima. So we can see already that we have a panel of committed, passionate, and folks that are personally connected. I'd like to have Tara. Tara, would you introduce yourself?
Hi, my name is Tara Watts. I am a wife, mother, and a classroom teacher. I teach fourth grade. I was diagnosed back in 2021 at the age of 36. I was diagnosed with stage 3 HER2 positive breast cancer. I am now finished with treatment. I am moving on with my life, and I'm so happy to share my story with you today.
Well, Tara, we are so happy to have you with us and so glad that your treatment has gone well. Jackie.
My personal cancer background is my grandfather passed of lung cancer in 2012, and my mother is a cancer survivor. She had breast cancer, stage 2 breast cancer, which she survived, and she was able to get through that in early 2020. And so, both my mother and my maternal grandfather were affected by cancer. So I'm just here to, share my testimony with everyone else.
Well, thank you for that, Jackie. So as you can see, we have a wonderful panel all of whom are dynamic individuals who are lending their time and their talent to raising awareness around the importance of cancer screenings. And so we're so excited to get the conversation started. To do that, let's do a level set by defining health equity, which is a term I know that we've heard quite a bit during the pandemic and offers a bit of a North Star for today's conversation. When I think of health equity through the cancer lens, it means everyone has a fair and just opportunity to prevent, find, treat, and survive cancer. Advancing health equity also involves the mitigation of systemic barriers that perpetuate health disparities and preclude some people from the opportunity to achieve optimal health. Some of those barriers include lack of access to quality care, economic and educational inequities, and discrimination. And so in order to ensure that everyone has the same opportunity, we at the American Cancer Society and our partners, certainly at Novartis and Blavity, are having this conversation so that we can do a deeper dive into the impact of the burden of cancer on the Black community. And I'd like to start by having Dr. Kamal weigh in on the impact of health disparities when it comes to cancer care for the Black community.
I think for many oncologists and oncology professionals, we're really at the beginning of a journey of fully understanding both the root causes and the impacts of health disparities in cancer care outcomes. There was a time where we didn't have many drugs or treatments or interventions for cancer care, and at that time the disparity was really that no one was doing well. And what we understand now is with so many new interventions, new exciting innovations, that what we're starting to see is that not everyone has equal access to that. So what that leads to is differences in outcomes. I think we're also running up against some myths and misperceptions that used to be there too. So for example, Tawana, you mentioned the differential outcomes in breast cancer care. It had been thought for a long time that it was related to different screening rates for African Americans versus other populations as it relates to screening mammography. And national data shows us that they're really at the same rate. About 75% of all women, be it Black or white or Hispanic, receive their mammograms, though there are pockets throughout the country where disparities continue to exist. But oftentimes it's not the mammogram itself. What it is that the clock starts as it relates to disparities in other components of access to care, meaning that time to scheduling of surgery, time to the beginning of chemotherapy, even the selection of the chemotherapy, whether it's aligned to national guidelines, and even the offering of clinical trials are all areas where we see systemic issues and potentially biases as well. So we know, for example, that within the Black population, those folks are less likely to receive recommended treatment, meaning if the guidelines or the textbook says do one thing, that maybe they're receiving something else. More likely to also receive delays in treatments. And because of all that, oftentimes then delays in the appropriate type of diagnostic interventions, that there's more likely to have advanced stage disease as well. And really, the root causes of these are both at the individual level. We know that, for example, individual oncologists are more likely to think that Black Americans would not want to participate in a clinical trial and thus don't bring it up when the opportunity may exist. But there's also systemic barriers as well. For example, health systems have not traditionally looked at issues related to social determinants of health, health literacy, where people live, how they live, their communities, their environments, how they like to receive information, the role of spirituality in their health care, the role of caregivers, collective decision making. Lots of ways where we actually have to tailor our care so that we're not marginalizing populations unnecessarily. And so I think that part of that too is really about cancer screening. What we know is that cancer screening detects about 40% of all cancers that are out there. And so we know it's one of the most impactful interventions to not only catch cancer early when it's more curable, but also to bring attention and visibility to the topics of cancer writ large. And we know that cancer screening is oftentimes has its own disparities involved in it. And then oftentimes things like prostate cancer, as an example, that we have in many ways created gray area about what people should do. And what that does is disproportionately affect Black Americans. For example, our data at the American Cancer Society shows a higher mortality rate among Black Americans when compared stage by stage to white Americans. That mortality rate is not subtle. That difference is not subtle. It can be 2 to 4x higher mortality rate. And we believe that's because that step, like shared decision making, is not a conversation that's happening, for example, between doctors and their Black patients. So there's a lot here to explore and unpack, and a lot of solutions we need to come up with together to address.
Thank you for that, Dr. Kamal. And I know we're going to get into the cancer screening piece in just a little bit, but you said a couple of things that sparked one or two thoughts that I have that I'd love for you to weigh in on. So can you talk about the role of education and outreach and community engagement as it relates to impacting health disparities? And within that, I would love for you to talk about trust, because we know that there are real issues around trust between the Black community and the healthcare system.
Yeah, thanks, Tawana. So, the American Cancer Society is leading the way in many regards, actually under Tawana's leadership, with a Health Equity Ambassadors program. The idea here, right, I think in general, is that I think it's one thing from a trust perspective. If I say as an oncologist, you should do something, I think it's also of added value and real added value when the person who's talking to is someone who is from where you're from, had similar experiences to the experiences you've had, and so that really the trust comes from a similar lived experience. And we know that that works in all components of healthcare, and so why would that not have a similar effect in cancer prevention and early detection? I think the country has had a very sort of sordid experience with talking to various populations about what the right thing to do is, because historically sometimes the right thing to do has been shrouded in what either scientists or the government or any number of people have wanted to push forward. And cancer screening becomes, really an area where an ounce of prevention is worth more than a pound of cure. But we have to acknowledge, too, that there have been decades to really hundreds of years worth of mistrust that the medical system has been part of moving forward. And that for us to create sustainable ways to build trust, we have to become a trustworthy organization. And as healthcare providers, we have to be transparent in showing our data in terms of time to treatment, making sure that people are aligned with the right evidence, and showing that to our communities so that we can be a trustworthy set of organizations. But at the same time, we have to work with community members so that we're not the only ones sharing a message, but that we're sort of linking arms in arms and talking through those right ways. Because fundamentally, there's 1,000,001 reasons why someone could think of today not getting a cancer screen. And so if you don't want to have it happen, or you have trust issues, or you don't have familiarity or health literacy around it, there are a lot of reasons why you wouldn't pick up the phone and make an appointment today. What we want to make sure is that people find a trusted voice within their communities and within their health systems together so that they do have a reason to make that appointment today.
Thank you, Dr. Kamal. I really appreciate the distinction between trust and trustworthiness, right? That's an important thing for us to remember. I want to talk about the impact of the drop in cancer screenings that we saw during COVID-19 for the Black community. We know that that drop resulted in cancers going undetected and caused many, many delays in terms of diagnoses. In fact, in 2020, an estimated 9.4 million screening tests that normally would have taken place did not happen. That's a big number, so I want to give some context. 9.4 million is nearly the population of New York City and Dallas combined. And over 220,000 new cases and over 73,000 cancer deaths are estimated to have occurred among Black people in 2022. That's over 73,000 deaths. In 2023, we're still feeling the impact of the drop in cancer screening, which is why we're continuing the Get Screened campaign to encourage people to get regular cancer screenings. And it's also why the American Cancer Society, Novartis, and Blavity are collaborating to talk about cancer in the Black community. So with all of that data, Dr. Kamal, can you give us some background on cancer screenings and what the Black community should know about getting screened?
I think that the concept of cancer screening can be a tough term for people to understand just in general, because it can bring a lot of emotion in general. All my patients seem to resonate with that. But at the same time, we can talk about, getting well, getting a checkup, getting a lung checkup, making sure that you're taking a proactive approach. And I think for a lot of folks, that's really the way to pivot it. So as for cancer screening, it's really important. The guidelines seem to shift frequently. That's because there's a lot of evidence coming out all the time about the importance. So let me just highlight them here really quickly. So for cervical cancer screening, that's for any person with a cervix, is recommended starting at age 25. And in particular, we want HPV testing to occur because we both have an intervention, HPV vaccination, and early monitoring, because about 98% of all cervical cancer is linked to HPV infection, which is a viral infection, and that viral infection can both be prevented through the vaccine, but also managed for people who carry that viral infection through frequent visits. And knowing that from age 25 onwards is really important. For prostate cancer in particular, for African Americans, they should start talking with their doctors at age 45 about what the right screening modality is. And that could be anything from a digital rectal exam and PSA test to any number of other more advanced tests like MRI. And that's really based on their family history, whether they have a history of a high PSA before, any symptoms, etc. And I think a tailored approach is really important. I would encourage everyone, though, to remember that as the guidelines say that shared decision-making is necessary, it doesn't mean, and this is what has happened, unfortunately, that oftentimes the conversation gets cut out, meaning that a doctor may look at a patient and say, well, for any number of implicit or explicit reasons, I'm not going to bring this up. And I encourage everyone, regardless of who you are, but particularly Black Americans who are at higher than average risk for prostate cancer, to bring it up and say, hey, should we talk about this? What should I be thinking about? What testing should I get? Are you sure we should wait? I mean, I think that's really important to bring up. Next is breast cancer screening. It's recommended for any person, any woman with breast tissue at age 45, with the option to begin at 40. I talk to my patients really to carefully think about it from age 40 onwards. It's also important to recognize that men can get breast cancer as well, and so that all individuals should understand their family history, in particular if they have a family history of an aunt with endometrial cancer, an aunt with ovarian cancer, that in itself increases the risk of the man having breast cancer. So a family history ends up being really important. Lung cancer screening is also probably the newest kid on the block. Not a lot of people know about lung cancer screening because it's about 20 years old. This is for people who've had a remarkable history of smoking sometime in their lifetime. And the idea is we know that if we do a low-dose CT scan, low dose means a low dose of radiation. So people get worried about, well, if I get a bunch of CT scans, is that going to cause another cancer? No. It's a very low dose of radiation, akin to like if you fly in an airplane, you're actually exposed to radiation through the sky because you're up in the higher parts of the atmosphere. It's equal to that. And with that, we're able to find lung cancers early. On the self-breast exam front, I think it's important that everyone understands too that knowing your bodies is really important. That goes for not only your breast tissue and what's normal, what feels abnormal, talking to your doctors about that, but also your skin. So, for example, we're seeing an alarming increasing rate in melanoma in Black Americans. And oftentimes things like skin cancer are not thought of in the Black community as being there, but we know that melanoma, for example, even the melanomas not associated with sun exposure are going up. And so I encourage all my patients to, make sure they know what their skin is normal for them, and to look in the little places that you may not used to be looking for, like under your armpits, in between your toes, in between your fingers. And then, lastly, I think really talking to your doctors regularly about the right tests, your risk factors, how you're living your lifestyle, prevention and early detection, particularly as it relates to weight gain. We know that sudden weight gain, particularly in women, is associated with some cancers like endometrial cancer and breast cancer. And we also know that oftentimes there are, things like tobacco, weight loss, and then, as I mentioned, family history. So again, let me say it again, that for family history, for a person to have higher risk of breast cancer, they may have no breast cancer in their family. But what they may have is ovarian cancer, endometrial cancer, stomach cancer, and that put together actually leads to that person having a high risk of breast cancer. So in general, knowing what all the cancers are in a family and the age at which they were diagnosed, meaning that the earlier they were diagnosed, the more we should worry, ends up being something really important that everyone can take control of in their lives.
Thank you, Dr. Kamal. So I heard a couple of things. I heard you mention the importance of tailored messaging and also utilizing the right messenger to deliver the message. So I want to, just before we transition, I just want to ask you to kind of weigh in on a couple of things, particularly for this audience. We know that when we talk about Black women and breast cancer, we often see that Black women are diagnosed at much younger ages with more aggressive types of breast cancer. So can you talk a little bit about that? And also, can you talk about what we're seeing with Black men and prostate cancer?
Yeah, well, I think both have some similarities. One is can be being dismissed by their providers. That oftentimes what we find is women who have some abnormality that they may feel themselves, but they may be in their 30s or early 40s, that for various systemic or bias reasons are ignored by the health system. And I think that's really important for people to advocate for themselves and say, nope, this is something different. And I want this checked out. I think in prostate cancer is the same thing as well. We're starting to see earlier ages of diagnoses, and oftentimes the same issue where we say, well, it's shared decision making, but it's not shared decision making if you've never talked about it. And so these things have to be talked about. They have to be talked about regularly. And I think lastly, oftentimes it can feel a little uncomfortable to talk about it as a family. And when people get together, sometimes it's the thing no one wants to talk about. I think that oftentimes that conversation can be a life-saving conversation because you want to know what did grandma have? And maybe it's not a conversation to have out in public, but pulling your family members aside and saying, was it bone cancer or was it breast cancer that started? Can we figure that out? And then, went to the bone. Can we figure that out? What age was she diagnosed with? Well, if she was diagnosed at 40 or 45, let's say your grandma was diagnosed at 45, no one really talked about it in the family. That's really important because that means for that person's child, they should start screening at 35 or sooner, meaning that their first mammogram should be then. And for the rest of the family members, they may have to start in their 20s. Those are things I talk to patients about. So it can be a life-saving conversation, but also recognize it can be a little uncomfortable. We should carve out time to make it very deliberate to have that conversation.
Appreciate that, Dr. Kamal. Don't go too far because we're going to come back to you in just a little bit. Tara, I want to go to you. As someone who has had cancer, can you tell us if cancer screening was on your radar?
Cancer screening was absolutely not on my radar. It was discovered, I'd say, by accident. I wasn't even regularly checking my breasts. I just finished breastfeeding my youngest daughter, and I just happened to check and feel around to see if all the milk had dried up, and I discovered a lump, and I thought it could have been a clogged milk duct. I didn't know. There was a little sense of fear, but then I thought, I'm only 36 years old. I breastfed all four of my kids. I'm overall healthy. I've never had any major health scares or issues. But I did schedule an appointment with my OB/GYN. That was just the first doctor I thought to go to. She wasn't overly suspicious of it being breast cancer because there were no other signs, nothing in the skin. It was just a lump. She thought it was benign, but she did give me a prescription to go get an ultrasound and a mammogram. Due to her lack of urgency, I didn't go right away. It was right before Christmas. I put it in the back of my mind. But a few months later, around April, I'll say March, April, another lump popped up in another area of my breast. And then I experienced some pain. So once those symptoms arose, I decided to go get the mammogram, ultrasound. One thing led to another, and before you knew it, I found I had stage 3 breast cancer, and it was because of the size of the tumors. They were like 6 centimeters, and it was in one of my lymph nodes. I did have lymph node removal and so forth, but it was a shock to my family. It was a shock to the people in my life, the community, people in my school building, my school district. Like, I've been in my school district for 14, 15 years. A lot of people knew me. It was a complete shock. So again, wasn't on my radar because of my age, because of my lifestyle. And because of that, I am a huge advocate of, speaking to what Dr. Kamal was saying, huge advocate of women getting screened earlier.
Tara, thank you for that. And you're sharing your testimony and using your platform and your experience, I know, is very helpful to other women in terms of understanding the importance of cancer screenings and knowing their bodies, right?
Yes, absolutely.
Jackie, I want to bring you in because your experience is certainly not as a patient, but as a loved one and a caregiver. And we know that when you get screened for cancer, it's not just doing it for yourself, but it's encouraging parents and grandparents, aunts and uncles, cousins, friends, all those aunties that we all now have, to make sure they're looking after their health as well. So with 2 close family members having had cancer, how does this shape how you and your loved ones talk about cancer and staying on top of your health?
Yeah, I mean, it's, unfortunately, my grandfather passing and then my mother, being able to go through her breast cancer. It's, for me personally, being an only child, it's a little alarming because it's so, it's so close. And so just my own personal health journey, like just trying to stay, as Dr. Kamal says, trying to stay ahead of it and trying to make something be a little more tailored towards my personal situation. And so it's not something that I'm necessarily screaming from the mountaintops, but I'm definitely having those conversations with my mother, having those conversations with people closest to me in regards to prevention and trying to get ahead of it, as opposed to like, pushing off the buck of like, oh, I don't need to go to the doctor. I don't need to get my yearly checkups and things of that nature. And so, as an African-American male, I'm 40 now, I'll be 41 in a few months. Very conscious of my family lineage and just trying to make sure, God forbid, if anything does happen to me, I can try to stay as ahead of it as possible. But it definitely is something that is like, I'm very consciously aware of, and something that I want to do my best to help myself and my fellow family and friends.
Thank you, Jackie. Rashima, you're in a unique position in that you have a deeply personal connection to cancer, as well as a professional role in cancer medicines. You oversee all things cancer in the U.S. for Novartis. So tell us, what steps are you all taking at your organization to address the health disparities we're seeing, particularly when it comes to cancer care?
Yeah, thank you for that, Tawana. We have a number of initiatives ongoing to help really break down these barriers that really create friction for patients, all patients, to be able to seek health care, whether that is screening, timely access to treatment, and follow-up care. And Novartis is certainly there at the table to play its part in all of this. But I do want to say no one entity will solve this. It is multifactorial, from the physicians who care for the patients, from the insurance companies, from the government, from also patient advocacy, and patients like Tara, who is really taking charge of this and getting the word out to other patients. From the part that Novartis is playing here, I'll highlight two important initiatives. One is in the space of breast cancer, in particular for Black women, and it is called the More Than Just Words campaign. And this is really an educational campaign geared at focusing on Black women, making sure that they are empowered, they know what questions to ask, they know when they should be screened, and partnering with a multidisciplinary team externally, whether that is patient advocates, that those are physicians who treat these patients, to improve education and cultural competence in talking to Black women about breast cancer, but also what Dr. Kamal talked about, that shared decision making, so that patients are empowered and are able to make sure that they are getting the best care that they deserve. So that's one. The second one is called the Beacon of Hope. And this is really a partnership with more than 26 historically Black colleges and universities, where we are creating centers of excellence to look at and to think about how we improve standards in science and remove bias. For example, during COVID, we saw the pulse oximeters. If your skin is darker, you're going to get a different reading. And what is the implication of that? The implication of that is that there may be a delay in getting life-saving care that you may need, because the readings were not based on any type of diverse patient population, and therefore you have inherent bias in some of the diagnostic tools that are used to diagnose patients. And so these are the things that we're looking to improve from using data science and improving diversity in clinical trials so we can extract that type of data. That's one. The other is really improving cultural relevance in terms of helping to deliver more medical professionals and technicians who look like the communities in which they serve. And we are committed over a 10-year period to help produce up to 1,500 new doctors, technicians, and professionals in the space of healthcare. So those are just some initiatives that we are committed to. It is a long-term initiative. You can't go in and out of it. And we do have a 10-year initiative here to stay in this space, to help do our part and create solutions that will be enduring.
Well, we certainly applaud your commitment to the work, certainly the education piece. We've already talked about how important that is, but I really like that you brought in the importance of training the next generation of cancer care clinicians and researchers and all of those that will be involved with helping us find an end to cancer as we know it for everyone. And it really is important that we increase the diversity of the cancer care workforce. So thank you for that work. Tara, your story resonates with this topic of community because you're a teacher. For many, you are the first impactful member of the community who has touched the lives of children and parents who passed through your classroom. How did your loved ones and how did the community at your school react to your diagnosis?
Well, it's interesting because I just started at a new school in my district, and my principal from the beginning was amazing. She was very supportive right from the start when I shared with her about my diagnosis and how, I'd be going to different appointments. I need to take off this day and that day. So I had the support at work. I had the support at home immediately from my parents. My husband was able to take off and be home with me. It was able to take me to all my treatments. Was able to help and take care of the kids. My school community came together and raised money for me, and for my family and I. Other staff members donated sick days so that I could get paid and keep my health benefits. So the community really came together, and that was huge. It took a load off. I could just focus on healing, focus on taking care of myself, and not have to worry about finances. And then in extension of that, I decided to share with my social media community. I have a following of lots of women, mothers on Instagram. And my husband and I talked about it, and they said, this is something that you should share your journey. And, when I decided to do that, I was overwhelmed by the support, but I was also overwhelmed by the impact it would have on other women and how it encouraged them to go and get screened, go get that mammogram. I would get DMs saying, I'm going to get my mammogram tomorrow because of you. I scheduled my mammogram. I finally went for it. Other women who coming to me, how do you remain so positive during treatment? Because, from the jump, it did help to have the support of my community, my family, and my friends and my coworkers. But my faith as well really got me through. But remaining so positive was a huge part of my healing. Knowing that cancer is not a death sentence. Because like Dr. Kamal was saying, years ago, hear that you have cancer, you think doomsday, you think that this is it. I'm not going to be able to see my kids grow up. I'm not going to, raise my girls and send them off to, be at their weddings. Your life flashes before your eyes, and it's natural. You're human, but knowing, the cancer research and, all these years you're saying, let's donate to cancer and all these fundraisers. It's really paid off. The amount of research that has gone into medications, and because of that research, because of all those medications, with the type of cancer that I was diagnosed with, there were targeted medications, targeted hormonal therapies. Even after I had my mastectomy, there was a little bit of cancer left. That's been my message to women. It's not, don't, you can be fearful, but have those fearful moments, but you have to look at, remain positive and just know that it's not over. You have, reach out, listen to your doctors, ask those questions, advocate for yourself. You're your own best advocate.
You said a whole lot, and it meant a whole lot to everyone that's listening, I'm sure. So again, thank you for your positivity and your testimony. When you said cancer is not a death sentence, I wanted you to say it 3 times for the people in the back of the room, because I think we really need everyone to understand that, and the way in which your community came together and supported you. One, says a whole lot about you, but it also says a lot about your community and the type of environment that you all have the privilege of being part of. So thank you again. Jackie, your perspective is different in that you felt the impact of a cancer diagnosis of a loved one who was a prominent member of her community. Can you tell us more about your story?
Yeah, it was tough. So interestingly enough, my mother was actually living in LA with me for a few years. And so she She went back to Philadelphia for a job, and I'd say not even within 2 months, she was diagnosed with breast cancer. And so it was, she had IDC, invasive ductal carcinoma, which is the most common, if I'm not mistaken. And so that was due to her having an overflow of hormones in her duct. And so this was something that she really, I don't think could have avoided. I was just thank God that she was able to catch it soon enough. And so it was really difficult for me being in LA while she was in Philadelphia getting treatment. We're speaking every day, FaceTiming every day. When I did have an opportunity to go there to visit her multiple times, going to see the oncologist, going sometimes for chemo and radiation. And so it was just tough. My mom, she's a really, really strong woman, and she had amazing support, particularly with my aunt, who's her youngest sister, and then two of my cousins who I'm really, really close with. And so that village was just like a godsend for me, just in relation to being there with her, in person, and being able to give me all the necessary updates and things of that nature. And so, like I said earlier, being an only child, it was really tough, especially given the fact that my grandfather had passed some 10 years before. And so for our family, as Tara earlier said, that you just automatically think death sentence. You just think automatically the worst. But in getting that news, there was something in my spirit that felt like once we found out exactly what this was, we were going to get through it. And so to Tara's point again, like just having that faith and knowing that we have this community, this village is going to like lift everyone up, and just make sure that we just give the love and support that we can and keep my mother's spirits high. I think that was part of the reason why she was able to push through. So now that, thank God we're through it. And so the process was very trying, but I'm just grateful to the doctors and the physicians and everyone all involved in, allowing her to be healthy today.
Thank you, Jackie. Certainly your mother's story resonates with me as a Black woman, as a mother. I know oftentimes, Black women and women, mothers in general, we kind of put everyone first, right? And sometimes we're, last on the list of things to do when it comes to taking care of ourselves. And I know your mother was a community leader, or is a community leader, right? Is a community leader. So can you talk a bit about how she was able to, move through her diagnosis with your support, the family support, also recognizing that she has, a big purpose that God has given her in terms of serving her community? What did that look like for her?
Yeah, I mean, it's another part of her testimony. She wrote a memoir basically telling her story, telling her testimony about how she fell in love with my father and how she kind of just stumbled upon this life. And so coming on the other side of that now, being a credible messenger, she primarily speaks to young men and women, I'd say between the ages of like 12 and 18, sometimes 21, and makes her best effort to try to deter young teens from drifting into the streets. And so now there's an added portion to her now being a cancer survivor. I think my mom is a warrior. Like she definitely, like Tara, you would have no idea what she experienced based upon how she looks. And so, like I said earlier, being her son and just being able to see, like, she can go into a room and speak to 500 people off the cuff and just have people in tears and things of that nature. And so she's just a very powerful speaker. And so upon having that diagnosis, it really brought her spirits down because, for one, she wasn't able to just basically go around and kind of just continue to spread her word, but also quite naturally just fearing for her life as well. And so now, like I said, now that she's cancer free, I'm hopeful that, for one, we can tell her story to a much bigger and broader audience. And now her full testimony of like having gone through what she went through, writing her book, but then also now being a cancer survivor. And so oddly enough, in the back of my mind, there's kind of this timer of like, I got to get this thing going, as soon, as quickly as possible. But also I just got to have faith in the process. So yeah, that's my mother's testimony in regards to her community work. And so my mother has a very fascinating story in regards to her previous life. And so now factoring in this cancer survival, I think it really just gave her some perspective on her life and, my life as well. Hopefully I'm able to live a long while and be able to inspire others and do some of the work that she's been doing in terms of inspiring the community, being fearless in regards to telling her testimony, and hopefully, spreading joy through the world.
Love that. I'm so grateful for her story of survival. And I want to stay there with the piece around inspiring others. So as a Black man who's had this experience as a caregiver, certainly recognizing, as we've just shared earlier today, the disparities that impact the Black community when it comes to cancer, how are you approaching your health and how are you sharing the message with other Black men?
I think you inspire people by your actions. And so, as I previously stated, trying to be proactive as opposed to reactive. So something as simple as just getting those yearly screenings. As Dr. Kamal said, trying to tailor your health towards like your individual self and not necessarily be concerned with what others are doing. I know there is a stigma around, especially for the African American community, in terms of like just going to the doctor on a regular basis. And so I think even just something as simple as those yearly screenings can go a long way. If you're having any kind of feelings or just strange sensations, just be vocal about what you're feeling and try to find a physician or a doctor that has your best interest at heart, doesn't treat you like a number, is somebody that really is concerned about your well-being. And I think you have to advocate for yourself so that these physicians and doctors can advocate on your behalf. And so I just try my best to just lead by example. So I've actually had some screenings as of recent, the last few months, just in regards to, because of my family history, just like, hey, like I keep getting diagnosed that everything is okay, but I'm also like, hey, man, like because of my family history, I just want to make sure unequivocally that like everything is okay. So I feel like me leading by example will hopefully inspire others to do the same.
Love that, leading by example. Rashima, you touched on your personal story earlier, but I'd like to hear more about your friend and how that shaped your view on cancer screening.
Yes, a little bit about my friend. I always say about her, if I had a twin, she would have been that person. We were born hours apart, within 24 hours. We didn't know that at the time, but we met in college, and we were college roommates. So it was a long-standing friendship. She's actually was the mother to my children. She was their godmother, so very close to our family. And I remember it like it was yesterday. I had actually just delivered my daughter, and she called me. I was in the hospital, and so home breast exams, lesson number 1. That's how she found the lump. She knew to do that. She actually found this in the shower, and she called me, and I remember thinking, similar to what we heard before, it probably isn't nothing, anything. We were like, 38 years old at the time. And so she did. She called the doctor, went in, and doctor didn't think it was much or what have you. It went from 0 to 60 really fast. Just thank God that her doctor wanted to take those precautions and to get all the tests done just to make sure, even though she didn't think anything was there. And it turns out there was something there. And she was diagnosed with early stage breast cancer, stage 2. There was a little bit in the nose at the time. And so she went through like it was about 6 months of treatment, radiation, chemotherapy, had a double vasectomy, and of course went through that, lost her hair, all of the things that we know that happens. And she had such an amazing, resilient spirit, though, because she was always about not feeling sorry for herself. She was human. She was afraid, but it was like, what's the plan? And as long as she knew there was something next, something to do, she was focused on that. And so she became, was disease-free for a very long time. In fact, 7 years. And this is a really important lesson also. Women oftentimes do not know their risk level even after, after the primary treatment and after the hormonal treatment, that for some women, they can still remain at risk. And she didn't know that. And when the cancer returned, she actually thought she had some type of sciatic nerve damage, and she was seeing a chiropractor. And I said to her, when's the last time you had a scan? And that's how she ended up getting, the scan. And the way she received the results was like over email, from an orthopedic doctor who had ordered the scan. She got it and didn't know what it meant. And so she sent it to me, and I remember pulling over on the side of the road and reading it. I said, oh my God, like her cancer is back and it's spread. She just has metastatic breast cancer. And I didn't know if it was the primary cancer or secondary cancer. So imagine having to tell your friend over the phone that this is what a report says. And I highlight that to say there's a great improvement that's needed in the healthcare system. Also, especially in the community setting where care can sometimes feel very fragmented. And, my big question was, did you tell them that you had breast cancer before? Because to me, it seems like that would have been one of the first things that was done. But she was able to get into an NCI designated cancer center. Thank God there were a number of targeted treatments that she was able to access along the way. And it did, I believe, extend her life. And unfortunately, we did lose her in 2020. But the work that I do personally here, I do that in her honor, to honor her and to make sure that we have more stories like Tara's and less stories like my friend. And that's, I think that's what powers us here at Novartis Oncology, to extend life and to help patients have a life more well-lived.
Well, thank you, Rashima, for how you're using the pain of losing your friend to fuel your purpose. And you have indeed a very special purpose within your organization that goes outside the four walls of your organization, which is so incredibly important. So we are getting close to the end of our time together. This is such a rich discussion that I really am having a hard time wrapping it up. But I would like to turn to Dr. Kamal to give us, you are the provider on the call, you're the clinician, but you're also the Chief Patient Support Officer at the American Cancer Society, and as such, you lead the work that we do to enhance and improve the lives of cancer patients and their families in many, many ways. So I'd like to turn it to you for any closing words.
Well, I appreciate everyone sharing their stories, and I think ultimately what I heard here, I've had a lot of training in science, and I could maybe understand the biology and so on, but what we're talking about here is family and love and relationships and connectedness and a real concern for our fellow human being and wanting them to do as well as they can. And I think fundamentally cancer screening, as much as it is about the science of when things happen, it's really about care and concern for our fellow human being. And I worry a ton during COVID-19 about how many cancer screenings were missed. That we know from our experience, for example, let's say with prostate cancer, when things got a little blurry and PSA stopped happening, particularly in Black men, that we've now seen an uptake in mortality, particularly amongst Black men, 5-6 years later. And what that means is that we don't see the immediate effect of misscreenings or lack of screening, but it's real, it's tangible, it happens 5 years later. So within one election cycle, we start to see it again. And I remain worried about that as it relates to COVID-19, that we're going to see a reversal in our fortunes. We've seen the mortality from cancer reduced by 25% since 1991. And the only thing that's going to reverse that trend, I think, is lack of screening, particularly from COVID-19. So I think for everyone, this is about relationships, friendships, love, connectedness, that what we should all do is take a moment, text someone, call someone, get a hold of someone today, and just ask the question, hey, I care for you, I love you, I'm concerned about you. Are you up to date on your screening? And then just a little gentle pressure that says, look, I'll help you get that done. And I think ultimately going from you should to this is how is where we want people to be. And I think all of us can be allies in that really important work that needs to get done.
Love, love, love that. So it's a let's do it together kind of thing, right, Dr. Kamal? So thank you to everyone, Dr. Kamal, Rashima, Jackie, and Tara, and thank you to all who have joined today to hear more about the burden of cancer in the Black community and the importance of cancer screening. So we didn't just share the data, but we shared information about the importance of cancer screening. This has been, as I said, such a rich conversation with personal stories and a clear call to action. We can each make a difference. Each of us can have an impact on our communities by first and foremost talking to a doctor about getting screened and then sharing and supporting our loved ones and family members in doing the same. The great Maya Angelou once said, when you know better, you do what? You do better. So let's each of us commit to helping our communities do better by sharing the information that we heard today. To learn more, please visit cancer.org. You can find the Get Screened campaign there. You can also check out our social channels to learn more about the Get Screened campaign. Remember, cancer screening should be a regular occurrence. It should be a regular part of your lifestyle and that of your loved ones. So thank you so much for joining, and be well.